Hello and welcome to our channel. Today we are going to take a look at past paper NCK exam, specifically the one that was done in 2004. At that time, it was one of the papers. That was paper 2 out of the 4 papers that were to be sat for during that period. However, by today's standards, many of these questions can be found in paper 1 of NCK exams. Okay, so let's get right into it. So here is our question number 1. The muscles that form deep layers of the pelvic floor are okay. Looking at option number 1, pubococcygeal, the transverse peritoneal line, and iliococcygeus line, right? You find that this second muscle is a superficial one, right? It's not a deep one, so this makes this option to be wrong. Number 2, we have iliococcygeus, pubococcygeus, and ischiocavernosus. Yes, this is also a superficial muscles, and this makes this option wrong. C, pubococcygeus, iliococcygeus, and transperineal muscle. These transperineal muscles, we had already identified it as a superficial muscle, right? And this gives us option D as the correct answer, all right? The muscles that form the deep layers of the pelvic floor muscles. Remember, we have the deep muscles followed by the superficial muscles and intermediate group of muscles. You can use this link on the muscle so that you can be able to see all the groups of muscles that are available. I think on the other side of it, if maybe you have not encountered this and you are to arrive at the answer, the best way to look is you could have looked at the similarities, all right? And I think if you look at the 4 options, option D is more of the same muscle with the suffix genius, and I think that should be able to assist you, all right? Let's move on to question number 2. The hormone that causes rise of temperature after ovulation is, well, if you look at option number 1, that is estrogen hormone. Of course, generally, if you look at several studies, they show that the availability of estrogen tends to lower the body temperature. So it can't be the cause where there is a rise in temperature, right, after ovulation. Option C, this majorly works on the helps in growth and maturation of the follicles before they can even produce an ovum. That is the process of ovulation. So this is way out of the equation. Luteinizing hormone, on the other hand, this hormone is just produced before ovulation, right? So it can't have an effect after, right? That leaves us with option B, all right? This is the progesterone hormone, and progesterone hormone is the one that is normally there to maintain pregnancy. It's the one that will cause a rise in temperature after ovulation. That takes us to question number 3. The management of a mother who develops constipation during pregnancy include advising the mother to. All right, let's start with option D. Taking plenty of warm water. Yeah, that is correct, right? Exercising regularly. Yeah, correct. Yeah, this one is also correct. But taking small amounts, remember constipation, somebody is passing very hard stools. I don't know how taking small amounts. So this one does not have a direct effect, right? And this makes this option D to be a wrong option. Option C, avoiding taking fatty foods and taking small amounts of food and taking high roughage diet, right? I think taking high roughage diet is the only correct option in this case. The others are not. Option B, taking a glass of warm milk, right? This has nothing direct with controlling constipation. Taking appearance, did you know what appearance are? These are just laxative, right? Laxative, and they are not the first option, right? We have other better simple options that we need to be focusing on, right? Taking fresh fruits, yeah, this one is correct, right? Option number A is the correct answer because here we are talking of taking plenty of warm water. I think that one we said it's the best option there. Taking warm water normally softens stools and it prevents also dehydration. Taking fresh fruits, we have also said is the correct thing to do because fresh fruits like apples, like the berries, like the peas, they normally promote bowel movement. And lastly, taking roughage diet. Taking roughage diet, this is a fiber-rich diet. This one normally adds bulk to the stool and it makes it easier to pass, right? Remember, when you are trying to manage constipation, you need to focus on fiber diet and encouraging hydration. Question number 4, the effects of preeclampsia on a pregnant mother will include. All right. Preeclampsia can develop to eclampsia. That's correct. It can cause placenta abruptio. All right. That is premature separation of the placenta from that wall. But it cannot be a direct effect of cause of anemia. So this anemia makes this option to be the wrong one. Equally, D, development of eclampsia, that's correct. Placenta abruptio, that's okay. But direct altered sleep pattern may not be a direct effect of a preeclampsia, right? So we have already disagreed with this option of anemia. It's not a direct cause, right? It is indirect. It's the placenta abruptio that can lead to that anemia, right? Okay, and furthermore, placenta abruptio is an emergency in nature, so the HB may not be reflected in that shortest time possible, right? Okay, maybe the HB could show a significant decrease in placenta previa, right? But you have to know that placenta previa is not a direct effect of the eclampsia, right? Preeclampsia major result in placenta abruptio. So for hematological disturbances, that part is correct. But the first two options, they make this option to be wrong, right? So that leaves us with option B for boy, placenta abruptio, development of preeclampsia, and hematological disturbances as the correct option here. Remember, we normally talk of the HELLP syndrome, right? The HELLP syndrome, where we have hemolysis, elevated liver enzymes, and low proteins, and that explains the hematological disturbances, including hemolysis, thrombocytopenia, and sometimes the DIC, right? Disseminated intravascular coagulopathy, right? Okay. Number 5, the following are mechanical factors that characterize the first stage of labor, right? Okay, so let's look at them. The first stages of labor, mechanical factors, right? Okay, so let's start with option D, cervical dilatation, general fluid pressure, and rupture of membrane. So cervical dilatation, if you look at it, this one will be noticed by the healthcare provider. So it's more of a clinical sign, right? Clinical sign, right? So like this one, a cervical dilatation, also the rupture of the membranes. You can at least be able to tell that, okay, cervical effacement. This one, it's you will be identifying them, right? It makes them to be more of the clinical factors, right? And this makes these options where this is included to be wrong, right? The best option for this question should be this one, where there's formation of four waters, general fluid pressure, and fetal access pressure as the factors that are the mechanical factors that characterize the first stage of labor. Number 6, in order to deliver the shoulder safely, the following must occur. Um, all right, so the shoulders, of course, will be delivered once the presenting part, in most cases, the head has been delivered, right? So we should, of course, at least rule out the normal processes that will help, first of all, the presenting part to be delivered, right? Like crowning, right? Crowning, right? Crowning, right? All these are going to help the presenting part to be delivered, right? Okay, so that one is crowning, and of course the internal rotation, right? The internal rotation of the shoulder. So just by ruling that, I'm able to remain with A as the best option there. Remember, reinstitution is normally the alignment of the head with the shoulders once the head has passed the birth canal, right? So this one normally helps the shoulders to align with the widest part of the pelvis, this external rotation. External rotation will help the shoulders to align with the widest part of the pelvis. And reconstitution, it will help realign the head with the shoulders once the head has passed the birth canal. So this one is the best option for us. All right? Okay. For question number 7 and number 8, it was you need to match these terms, right? You needed to match. So number 7, they had given column A, they were talking of first two pubis, and number B, first presentation, number 8, after coming head in breech, and then extended head in breech, right? And these were the option that you are supposed to pick on, right? And you indicate the numbers. All right, if you look keenly, you'll find that this second option, middle finger in the mouth, index and ring fingers on the mandible, two fingers of the left hand hook up the shoulders, traction is applied downwards and outwards until the nose and the face are free. All right? Okay, that is after the coming up of the head. All right, so this one is related to this one, right? Okay. When you go to number 3, that is grasping the baby by the foot and hold on stretch, mouth and nose are free. The vault of the head is delivered slowly, right? So 3, this is 8B, head in a bridge presentation, right? Okay, so here then is related to this one. Okay. Number 4, the sinciput emerges under the symphysis pubis as far as the glabella. Hold back the sinciput to maintain flexion until the sinciput sweeps the perineum. Extend the head by grasping it and bring the face down from under the symphysis pubis. Deliver the head by extension, right? So this is the B, right? This is the B here, the 7B, right? 7B, this one is number 4, that is face presentation, right? And now we have the 7, where you're going to hold back the sinciput to maintain extension, permit the mentum to escape under the symphysis pubis, and allow the head and the occiput to sweep the perineum, and the head is born, right? That is 7A, right? Number 7, face to pubis. So those were the 2 questions, and here you needed to match the terms in A and their sequence in B, right? Okay. Now that takes us to question number 9, and in question number 9, we are saying that persistent occipito-posterior position indicates that the occiput So when you have persistent occipito-posterior OPP position, that indicates what? Yes, the occiput has failed to rotate forward, right? Has failed to rotate forward. So that means we're going to have OPP, right? Okay, so it can't be the leading part, right? OPP, that means what? The face will be the leading part, right? Fails to rotate, it has failed to rotate. So this gives us this one as the correct answer. When plotting findings on a pathograph, obstructed labor will be indicated by obstructed labor, right? Let's look at the options that we have. Poor cervical dilatation, fetal distress, and clear liquor. We agree the first two. Clear liquor may not be an indication of obstructed labor, right? Obstructed labor needs to show some color changes to ensure that the baby probably is in distress, maybe, right? Yes. B, we have slow descent, mild uterine contractions, and early rupture of membranes, right? So mild uterine contractions may not show the obstructed labor, right? Obstructed labor, sometimes the contraction may be mild, moderate, could even be strong, sometimes could even be ineffective, right? So that no progress is being made. Fetal distress, clear, we have already talked about this clear liquor. This makes this answer wrong, or the mild, and that's why we have option D as our correct answer, where the pathograph is going to show slow descent, poor cervical dilatation, and early rupture of the membranes. Okay. Number 11. The normal fetal hemoglobin level at term ranges between, right? How many grams per deciliter? Number A, this is very low, right? This is very low for that neonate, right? And number D, this is very high, extremely high. So again, this one, somebody could be suffering from polycythemia, right? The correct option, the correct range will be 14 to 16 grams per deciliter. Oxygenation of the fetus during intrauterine life depends on, all right, this is adequate oxygenation of the mother. That's correct, right? This is the first part that is correct. We have adequate perfusion of the placental area. That's still correct. And having the adequate fetal hemoglobin. I think this one gives us the correct answer for our question, right? Fetal, whatever, right? Okay. This one may not be a real factor in determining oxygenation of that fetus. Okay. Maturity actually does not matter. For oxygenation, the fetal hemoglobin takes precedence over the maturity, right? Maturity may be a problem now in the extrauterine life now, thereafter. So this one we have already said is not correct, and that's what makes those other options not the best. Signs of respiratory distress syndrome include, distress syndrome is an emergency, right? So no need for the cold signs, right? So like cyanosis, this is a sign as for a cold case. Yet this is an emergency, right? We have so cyanosis, that makes most of our answers wrong here, right? Yes. Right. Respiratory distress, rolling of the eyes, this might not be a direct sign, right? This is maybe an indirect sign, right? That is involved here. Also the convulsions, right? Okay, maybe this is a problem with the nervous system, right? Gives us option B as the correct answer, where the patient is going to present with tachypnea, substernal and intercostal recession, and expiratory grunting. The observation of a midwife that she should carry out on a baby undergoing phototherapy include phototherapy, right? Phototherapy, that is an important session for patients who are presenting with what? Yes, so I want to at least work on that in phototherapy. We vomiting is not an expected side effect, so this one will have to remove automatically, and you can see it's still appearing here. Makes these two options wrong, right? So we have diarrhea, edema, skin color. Skin color, yes. We are also going to look at signs of dehydration and edema. They should not diarrhea. Really, this is not an expected sign. Now, because of the light, the slight heat, some may have some color changes. The baby might appear dehydrated, and some parts edema, right? Not the other way. Lochia rubra occurs, right? I think we have already agreed to remember the three types of lochia. We normally say talk of Republic of South Africa, right? So Republic of South Africa. This is the rubra, the serosa, and the alba, right? And of course, serosa is usually red, right? In the first 3 days. So we have three. Then we have at least this one serosa is the one that the color most candidates will forget. It's supposed to be pink. It occurs on from day 4 to around day 10, right? Then the alba is what again most of us know. It's usually white. So we talk of red and white, right? So this is white, and from day 10 onwards, right? Day 10 onwards. So rubra, this one is the first one, right? It occurs within the 3 days. So the option that sharing that information, I think, is option number C, right? It occurs on the first 3 to 4 days, the delivery, and we have its color. It's red in color. All right. Advantages of breastfeeding will include what? Remember the advantages of breastfeeding. All right, let's start with option D, assisting uterine evolution. Yeah, encouraging family relationship. Oh, should just be mother to baby bonding, not really the whole family, right? The whole family, that's a different issue. And you can see here again, that is a wrong option for for that option, all right? And it can help us eliminate the wrong answers, right? Let's look at option C, mother bonding. Yes. Regulating body weight. Promoting family planning, right? Not family planning, ensures family planning, right? So this one is not direct. I think we have enough reasons to believe that this is the best answer. Mother-baby bonding, assisting in uterine evolution, and also inhibition of ovulation, and that explains why lactational amenorrhea method uh, can also be able to help in terms of family plan, right? So these other options are wrong. The best is option A. Urinary tract infections during puerperium is usually precipitated by. So we have several options here. To find early rupture, this is not a primary factor for UTIs, right? Frequent vaginal examination, also not one of here. Personal hygiene and birth trauma. Birth trauma could explain some congenital injuries and not urinary tract infection. I think we all agree that the most common problem here is the retention of urine, which is supposed to encourage the mother to please empty the bladder. And also this catheterization, they could predispose the gland to such infections. The useful registers to be kept while monitoring pregnancy and providing prevention of mother-to-child services include, all right, so uh, while pregnant, and the document that normally keeps the records of a mother while pregnant, of course, is the antenatal register. So the antenatal register, we need it. I'm happy it's here. It's also here. Antenatal register missing here, right? It's missing here. Antenatal register, it's here, right? Okay, so we can have at least those three options for now. So while providing prevention of mother to child, right? Please, the RV register should be there, and I'm happy option A still has it. Option B has it. Option C has it, but we already said it's lacking antenatal register, right? RV register is also here, right? Okay, now we can have at least the others, the other registers. Like now you need to cancel, right? Cancel because they are on, they may be on hard. Canceling is also here. I'm happy canceling is here, but we already said it does flat the antenatal, so it's wrong right here, right? Okay, then we have, so this one is lacking again, but we keep it for consideration. It's lacking the canceling register, right? The canceling register. All right. From there, we can talk of the vaccines. The mother, when they're being monitored, they need also to be put on vaccines. So do we have vaccines here? Yeah, it's there. We have the vaccine register there. How about here? Delivery register. Delivery, we are still monitoring. We don't really need the deliver the MOH 333, right? We don't need it at this point, right? We need it during labor and delivery, not now, right? So at least we have A and D, right? I think what I think A should be the best option, because at least I can see here we have antibiotic register. This is not a basic documentation, right, for this mother, right? Okay, unless they have an infection, that's when we are going to need antibiotic register for that, right? And also laboratories too is minor, right? We could need the most important document like the counseling, which is missing in this option, right? Characteristics of fertile cervical mucus are okay. So option A, I think we agree it should not be opaque, right? It should not be clumpy, right? Yes. Sticky, no, right? This opaque makes this option wrong. Transparent, yes. Sticky, nope. It should be stretchy, transparent, and slippery. I think those are the characteristics of a fertile cervical mucus. The immunization administration the immunization that is normally administered at birth include what? Now, this one we are specifically looking at the immunization schedules in Kenya, right? I'm sure they'll be different from United States. From United States, hepatitis B will make sense, but not in our case. But BCG is not a problem in US because of the low rates of infection. BTB is still a problem in Africa and more so in Kenya. That's why we need that. So if you're working in Kenya, we will need BCG and birth polio, right, as the vaccines that will be administered at birth, right? As I said, this will be different when you are working in other countries. But remember, NCK, this is an exam administered in the Republic of Kenya. So we have to go by that to get the correct score here, and that is option C. The other questions about short answer question, they ask about draw and label a diagram to illustrate anterior posterior diameters of the fetal skull and their measurements. And I think you need to remember we have the sub-occipital pragmatic diameter, we have the parietal diameter, occipitofrontal, and the mentobilangular diameter, bitemporal diameters, all right? And they have their measurements, all right? 9.5, 12. Mentos bilingular diameter, right? You can see it's the widest, right? While the shortest one is what? The bitemporal, right? Bitemporal diameter. Explain 5 functions of the placenta. So here we have several. You could talk of nutrient exchange, you could talk of gaseous exchange, waste elimination. You could also talk about hormone production, especially the HCG hormone, the progesterone hormone, the estrogen, and the human placental lactogen. Other functions include immune protection, barrier function, fetal waste removal, and protection from maternal immune systems, right? What about the next question? State 4 complications of polyhydramnios. You know, polyhydramnios is a condition of having excessive amniotic fluid, and it can lead to several complications, including preterm labor, premature rupture of membranes, the one that is commonly referred to as the PROM, placental abruptio, we have fetal malpositions, postpartum hemorrhage, right? And so many others. The other question is state 4 causes of obstructed labor. Obstructed labor occurs when the fetus cannot progress through the birth canal despite strong uterine contraction. So we have the CPD, the cephalopelvic disproportion, malpresentation and malpositions, fetal anomalies. We have uterine abnormalities, soft tissue obstruction, ineffective uterine contraction, prolonged labor and exhaustion, right? The next question was explain 3 activities of a midwife during active management of labor. Remember, you need to administer uterotonic drugs like oxytocin, where you typically administer 10 international units intramuscularly, sometimes intravenously, and this is immediately after the delivery of the baby, just to stimulate effective contraction that are going to help expel both the placenta and also reduce blood loss, right? Okay. The nurse is also supposed to carry out the controlled cord traction, commonly referred to as CCT, and this is just to assist the delivery of the placenta while minimizing the risk of uterine inversion or excessive bleeding. You also monitor for signs of complication to ensure that there is early detection and management of any potential complication during labor or immediately immediately after the delivery, right? The other 6th question was you explain 5 predisposing factors to cord prolapse. Remember, cord prolapse occurs when umbilical cord slips down into the birth canal ahead of the baby or alongside the presenting part and potentially compromising the blood flow to the fetus. So we have several. We have fetal factors, could be malpresentation like bridge, transverse, compound, or you could be having a fetal factor like prematurity or small fetus. Maternal factors like polyhydramnios, multiparity, and pelvic abnormality. Obstetric factors like unengaged presenting part, artificial rupture of membranes, multiple pregnancy, long umbilical cord, preterm labor, and high parity are some of the factors. Question number 7 was state 4 categories of baby who are at risk of developing hypoglycemia, right? Could be preterm babies, infants of diabetic mothers, small for gestational age or low birth weight babies, infants with birth asphyxia or respiratory distress, large for gestational age, infants born to mothers who on certain drugs like the beta blockers or the oral hypoglycemics, babies with intrauterine growth restriction, infants with sepsis or infections, babies with endocrine disorders, babies with genetic metabolic disorders, right? Question number 8, you state the difference between preterm and light for dates baby. Remember, preterm baby is also referred to as the premature baby, while a light for dates baby is referred to as small for gestational age or intrauterine growth restriction. Okay, and both they differ in so many ways in terms of the gestational age, the birth weight, the growth pattern, and some of the causes and the physical appearance, along with health risk prognosis, right? The other question was about explaining measures a midwife will take in management of puerperal pyrexia, right? Remember, puerperopsychosis as pyrexia is defined as maternal fever of 38 degrees Celsius, that is equivalent to 100.4 degrees Fahrenheit or higher, and it should be occurring on any two of the first 10 days following childbirth, okay? And this of course excludes the first 24 hours. It's usually a sign of infection or any other complication during the postpartum period. So what are you supposed to do? Do assessment and monitoring. You're assessing the temperature, the vital signs, the physical examination, and the Lochia. You're also looking at the laboratory investigation. Those are lab tests, blood cultures, urine cultures, vaginal and lochial swabs, and wound swab. You're looking also at the administration of the antibiotics, both the empirical and the specific antibiotic treatment, also hydration and nutritional support. We have wound care, we have management of specific infections, pain management of analgesics, education and emotional support, and also follow-up. Ladies and gentlemen, remember in PEP 1, we have several topics that needs to be covered. Remember, in PEP 1, we are looking at adult nursing, pediatric nursing, critical care and theater nursing, professionalism and trends in nursing, communication and counseling, introduction to reproductive health, pregnancy, labor and the puerperium, contraceptive technology, gynecology, and lastly the STIs and HIV. All these topics will be found in paper 1 of the Nursing Council examination. Please keep following the channel so that you can also be updated on other past papers of the same.